Sibling Support Playroom Grant Request, Mary Kay Kelly, Assignment 3. Next slide. This is my cover sheet that is stating a grant request for $5,000 to build a siblings-only playroom at the Children's Hospital at Montefiore. Next slide. The Children's Hospital at Montefiore aims to meet the psychosocial, emotional, and healthcare needs of all children and families in our community. Located in the heart of the Bronx, the Children's Hospital at Montefiore, also known as CHAM, has been serving a diverse population of people from all cultures, languages, and creeds since the 1880s. CHAM has been nationally recognized as one of the nation's top leading pediatric hospitals for over 9 years, serving over 9,000 children annually. We are proud to say that over 75% of our hospital population gets insurance through the Affordable Care Act. We aim to create an environment that meets the needs of the families from all walks of life without judgment or hesitation, not only within our hospital, but within the entire community. The Child Life staff at CHAM works to uphold our standard of excellence by providing our patients with educational and developmentally appropriate play to help cope with various medical challenges. Our Child Life staff, a team of 12 full-time individuals and 4 part-time members, works to meet the needs of not only the patients, but the entire family, including the siblings. The playroom assistants, volunteers, and outside organizations that we are partnered with help to create an environment that is both child-centered and therapeutic for our patients. We are partnered with several different nonprofit organizations that bring recreational activities into the hospital for our children and families, such as Sunrise on Wheels, Project Sunshine, the Hole in the Wall Gang. These organizations provide our patients and families with services very similar to our own, but their focus is on recreational play instead of therapeutic play. Next slide. Currently, all of the Child Life playrooms at CHAM are for patients only, leaving the siblings without a safe space to express themselves away from the patient rooms. Sibling support is extremely important because oftentimes when a family is dealing with the stress of one of their children being hospitalized, the needs of the other children tend to be forgotten and ignored. Researchers Havermans, Wyatuk, Dobell, and others conducted a study on the emotional effects on siblings of chronically ill children. They've stated, internalizing behaviors have been reported that describe siblings as worrying more, being jealous of the sick child, feeling lonely and anxious, and having low self-esteem. As child life specialists, we believe that the easiest way for children to combat these feelings of loneliness and jealousy is through therapeutic play, and without a space of their own, it has remained an underserved population. The Child Life Council has stated the following competencies as goals that each individual child life specialist aims to meet when working with siblings and patients of all ages. Competency A states the ability to assess the developmental and psychosocial needs of infants, children, youth, and families. Competency C, the ability to provide opportunities for play for infants, children, youth, and families. Competency D, the ability to provide a safe, therapeutic, and healing environment for infants, children, youth, and families. All 3 of these competencies would be met with the space provided in a siblings-only playroom. Next slide. We are requesting a grant to be used towards creating a siblings-only playroom. This playroom will become a safe space where child life specialists can work with siblings to help them focus on themselves, express their emotions and thoughts, and learn about their siblings' diagnosis. Having a secluded space that is for siblings only and free of medical professionals or invasive procedures will also help with infection control for our immunocompromised population. We intend this room to be for siblings only, but we will encourage caregivers to be allowed into this space as well. We want this to be an environment where siblings feel free to express themselves individually, separate from their hospitalized sibling. and we believe that support from the caregivers will only encourage more developmental growth. If we are granted these funds, they will be used to transform a pre-existing space with proper seating, decoration, and storage. We estimate that at least $5,000 will be needed to transform the pre-existing space, and the Child Life team will rely on donations and volunteers to stock the room with toys, games, and supplies. I will be leading this project alongside some of my fellow Child Life specialists on staff, and we anticipate that the construction and renovation of the playroom will take about 3 months' time once we receive our grant and permission to begin construction. Next slide. This playroom will be where the Child Life staff can hold interventions and play sessions to meet the psychosocial needs of the entire family. A siblings-only playroom will help us to meet the psychosocial needs of the entire family, and as Child Life specialists, we measure the success of our interventions through patient cooperation, appropriate coping mechanisms, and displays of understanding and emotional growth. When working with siblings, it is vital that we recognize when a child feels validated and heard during this stressful and vulnerable time. Our goal is to be able to conduct these important sessions in a room away from the overwhelming medical environment and to create a child-friendly atmosphere where children can relax and express themselves. We will measure the quantitative success of this space by recording the number of siblings who attend and how frequently they return to the space. If we are to receive this funding, we would expect to have a fully functioning open area space that accommodates multiple children and adults and provides options for different types of developmental play. Resources.